I'm very pleased to be joined by Shirley Mertz. Shirley is a board member of the Metastatic Breast Cancer Network, which is MBCN.org. And I would love for you to tell us something about the organization and your work with them and why you do what you do.
The Metastatic Breast Cancer Network was founded in about 2004 by two women who had metastatic disease. They lived in New York, and they attempted to join a breast cancer group for support. And when the other women found out that they had metastatic disease, they kind of shrunk back, and the two women realized very clearly that they were not very welcome. And they sensed that it was a matter that they had a disease for which there was no cure, and it just didn't sit well with the other ladies who were, hopeful that they would never recur, and that some, though they were in treatment, knew they'd be finished, and others were finished, so it just didn't fit. So the two ladies discussed what they could do. They felt they were outraged. There were needs of metastatic people that weren't being met. So they worked with a social worker out of Memorial Sloan Kettering, and they founded a group, and it ultimately became known the Metastatic Breast Cancer Network. And one of the doctors, Dr. Larry Norton, supported their cause. And in fact, he offered to do a little program in 2005 about metastatic disease. We are here to inform, provide information, to educate patients and their loved ones, and then to provide support. I became active in the sense that I believe strongly in advocacy, and I love research about metastatic disease to empower myself and others. So we provide every year, a metastatic conference that occurs in October. Our last one was just October 29th at Johns Hopkins, and every speaker presentation is on our website. You can click on bone mets or soft tissue surgery or whatever, and you can listen if you didn't attend. We put patient stories on. Myself and another board member research the internet and scientific journals for articles that patients can use, and then we upload those. The Metastatic Breast Cancer Network realized early on from patients that the one thing they were really lacking was information at the time of their diagnosis. The shock first of the knowledge of the disease, but then you want to read about it. And unfortunately, most physicians don't have anything to offer. So we took the time, with the help of medical professionals, to create a kit that provides information to newly diagnosed patients about the disease, how to access good care, how to access other services, and just to know that there is help out there and that they can live a long quality of life. We make these kits available for free. People can go online at mbcn.org, request a number of them. We will send them out to them for free. They also can download the kit off the website. And to date, we have sent out 8,000 kits to patients, caregivers, oncology nurses, and physicians. And we hope with each year to update the kit, and we've really had a lot of feedback that this has been helpful. One of the things that I thought was very important is that we really needed a day in October to be devoted to metastatic disease, because the whole October Pink Month is about early stage. So we had been trying through local mayors, like the mayor of New York, mayor of Chicago. They were willing to designate a day. The first one was October 13th. It just happened to be the day of the week that they wanted to use. And then I got the idea that, my goodness, by the time we'd wait for everybody to be healthy enough to contact their mayor or their local or their governor, it could be years. So I remember meeting Marvella Bai when I was selected for an award in high school. She was the wife of Birch Bai, the senator in Indiana. She ultimately died of metastatic breast cancer, and she was very active in her day. And her son was a senator at the time in 2008 from Indiana, Evan Bai. So I wrote him a letter, I went to the office, and I said, would you sponsor legislation to declare a national resolution that October 13th would be Metastatic Breast Cancer Day. And so he said he would do it. I worked with another woman to organize a group of metastatic patients. We went to Washington, D.C. Representative Rosa DeLaura from, I believe, Connecticut, sponsored the House resolution. We visited 12 offices. Imagine there were 9 metastatic patients. Most of them, well, were all in treatment, but some debilitated, some not so debilitated, our family members, and we went through 12 congressional offices to get support. We also fought for an end to lifetime limits, et cetera. And then we went home and we used our network to have women across the country call their local representative, their senator, and say, support this. And we got it. And ever since then, we have been using that day to get our word out in a variety of ways that, you know, metastatic disease is not an immediate death sentence. It's not curable, but with more research, we can live longer and live a good quality of life. Really, as long as I'm standing, I'm going to work to help metastatic patients, both men and women.
Thank you.
You're welcome.
Shirley Mertz, Metastatic Breast Cancer Network board member, living with metastatic breast cancer, yourself living well and wisely, MBCN.org.
Thank you so much.
It's a pleasure.